Somebody. Good afternoon, everyone. Good afternoon. Welcome back to our MIT Men in Training Recovery Support Group. My name is Craig. I am someone who's also in recovery. And so today, I like to bring an article that I think is very interesting when it's talking about learning some mentoring life skills, some things that can be utilized, especially for all of us who went through some form or fashion of drug addiction or alcohol addiction. So what we're doing here is our goal is to reshape mindset from a negative behavior to that one of positivity. And so without further delay, I thought it'd be nice to bring a article brought to us by Simcoe Rehab.ca. Simcoe Rehab.ca. You can go online and retrieve this article. But the title of this article is, what are the 15 coping skills for addiction? This is our MIT, stand for Men in Training Recovery Support Group. And so this article starts off by letting us know one of the 4 tenets of relapse prevention after addiction treatment is to develop healthy coping skills. Learning ways to deal with stress, underlying mental health symptoms, and negative emotions is crucial. As some experts believe, people use substances as a maladaptive way to cope. That word may sound big and fancy. If you look it up, I'm quite sure it means unhealthy way to cope. All right? Picking up new, healthier coping skills for addiction is something people learn in therapy. So this article says, today we want to give individuals and their loved ones a glimpse of the activities and habits therapists help people with addiction cultivate during recovery. All right? And so let's get right down to the meat and potatoes of it. Today's first topic of discussion, or discussion of information, that is, coping skills for addiction. Coping skills are essential to staying sober after rehab. Very important. They help people in recovery avoid or deal with triggers and cravings that may lead to relapse. As an added benefit, positive coping skills are excellent for overall well-being. Read that again. As an added benefit, positive coping skills are excellent for overall well-being. They promote holistic health, a healthy physical body, mind, and spirit. What are the best coping skills to cultivate during recovery from drug or alcohol addiction? All right, so it says, here are the top 15 skills people learn in addiction counseling supported by addiction recovery research. Right, this information has been researched and brought to us as such. Number 1, learn to relax in any situation. This article says stress is bad for all aspects of human health. It can impact someone's ability to concentrate, elevate blood pressure, and contribute to inflammation. In the long term, stress can increase the risk of chronic health conditions, digestive systems, and mental health disorders. Addiction and stress are also linked. Stress can make someone more likely to start abusing substances in the first place, right? Or it can be a trigger for relapse after someone undergoes treatment. Learning to relax in stressful situations may help reduce the risk of relapse. Get started with the following grounding techniques. Grounding techniques for relaxation. They give us some examples or a list of, I believe, exercises for relaxation. Grounding teaches people to relax, stay centered, and focus on the present moment. Some of the best grounding techniques to try, and they are doing deep breathing exercise. So if you feel intense, feeling nervous, feeling stressed out, or something that trigger you, do some deep breathing exercises, right? I went to a program. I was in program was a group called Behavior Modification. And so I am someone who lived the experience of both environment when it comes to rehab and reentry. And so we used to do what they call desensitization breathing techniques. And if once you really get into it and you participate in it, you begin to feel more relaxed and calm, right? That's number one. Walking, stretching, or doing light exercise. Simple things to do. Nothing's too strenuous from this perspective. Reciting affirmation, all right? Do some reciting affirmation, you know. I feel good today. Today is going to be a great day, you know. I'm not going to pick up alcohol or drug today. Do some self-talk, all right? Gratitude journaling. If you're a person who like to journal, do that. Identifying one's sensory experiences. Take a warm bath. Wow. We talk about relaxation. Now that one will really soothe you in a stressful day. If you have one, you want to go home, you want to take some time out, you know, and especially if you're living with someone, you may want to tell them, say, you know, I had a tough day, or I had a strenuous day. Give me 5 to 10 minutes to gather myself. And if they respect your wishes, they will give you that space where you can just take a warm bath. Right, there's some good stuff, you know. That one there, this one here, I never thought of it in that aspect, but it sounds very therapeutic. Listening to music, that's a good one. Spending time in nature, that's another one. All right. Practicing these activities when stress or trigger can help people feel less overwhelmed and calm down. Grounding techniques are also helpful for people who are triggered by intrusive traumatic memories. Wow. All right. So that's some good stuff when we're talking about learning how to relax in any situation. Number 2, this is major. Wait to respond. Impulsivity is a hallmark of substance use disorders. People with addiction may be more likely to react without thinking or fail to inhibit maladaptive responses. These behaviors happen due to the effects of drugs and alcohol on an area of the brain known for regulating impulse control. Wait to respond. Don't be quick in a hurry to respond. Assess the situation, all right? Think about it. They could give it some deep thought. Acting impulsively can be a reason for the interpersonal struggles common to people with addiction, interpersonal struggles. These interpersonal issues are painful and may even trigger someone to relapse, all right? And so there may be some things going on that we may have to really give some consideration, or as always, we always recommend that people who may be dealing with issues or facing issues of relapse, whatever it may be, any types of trigger, trauma, we always recommend that you seek professional help. All right. I'm a recovery coach. I'm a certified peer recovery coach. Peer meaning I am just like those who this information is basically intended for. But it's also can go out, can be shared beyond just the person who's in addictive behavior, because we know that addiction is a family disease, and I know you may hear that term. Addiction is a family disease, and you may say, "Well, my family or my loved one does never use," but they are affected by the one who is actually in the addictive state. Let's move forward. Preventing this problem is as simple as taking a breath and waiting to respond when angry, irritable, or triggered. Thinking before acting can help people in recovery react to situations with a more logical approach. This is some great stuff. Preventing interpersonal issues, right? Unresolved issues, and retaking control of their lives, all right? Waiting to respond. We're talking here about what are the 15 coping skills. We're informing people about 15 coping skills today for addiction. Okay, and a lot of times, as this article made mention, people who behave or respond to situation poorly, they may have some maladaptive coping skills, unhealthy coping skills. Today, we want to learn some healthy coping skills. All right. Number 3. Let's get into number 3. Playing the tape through. Woo! Playing the tape through. Very interesting. Playing the tape through is a technique taught in cognitive behavioral therapy, better known as CBT. It is another helpful way to regulate one's impulses, even when they have been dysregulated by substance abuse. The technique is particularly useful for people with addiction dealing with cravings. Drug or alcohol cravings are one of the main diagnostic criteria for substance use disorder. Let's read that again. This technique is particularly useful for people with addiction dealing with craving. Drug or alcohol cravings are one of the main diagnostic criteria for substance use disorder. The severity of one's craving also has clinical significance for predicting treatment outcomes. All right? When someone experiences a craving, this CBT technique teaches them to stop and remember their motivation for getting sober. Play out the potential negative consequences of relapsing, and the craving will likely pass. All right? And so play the tape through, make an assessment, all right? And that it will give us a better outcome. 9/10 of the time, when I play the tape through, I really have positive results. I really find myself not getting into confrontation. I learn to assess the situation. I assess myself, and I always try to remain calm in the situation. Not saying that it's easy, but I keep doing it over and over. And so far, I'm being successful with it. Now, do I have bad days? Of course, we all gonna have bad days. Don't put yourself down. Don't stay down in the mud. You know, learn how to bounce back. Be resilient. Learn how to bounce back. And so if you may come up short and fail and didn't respond appropriately that time, say to yourself, well, I'm learning. And so as I learn, I'm going to do better. And the next time something was to occur, I'm going to ace it. All right? That's some encouragement that I want to share with someone today. Let's go on, because today we're talking about 15 coping skills for addiction. We just did number 3. Now we're going to number 4. Be honest with yourself and others. The article says lying is a common habit of people with substance use disorder. You know what that is. We all may know what that is. We all is aware of what lying is, and that is being manipulative, cunning, baffling, deceitful, and all that stuff. They may lie about their drug use to avoid confrontation or treatment, or they may lie to obtain the time or money needed to use. After treatment, people must learn to be honest about their addiction. They must be honest with others, but also with themselves about their potential to relapse and what should happen if they do. Honestly, expressing feelings and emotions towards others and oneself is also a helpful skill for improving interpersonal relationships. It can be the first step toward building trust and mending broken friendships and romantic relationships. Wow, that's some good. This is some really good stuff here. This article is very informative and it's teaching us some life skills. It's teaching us some things, the do's and the don'ts. And so, one of the things that I learned when I was in the therapeutic community, positive reinforcement. I had to learn that coping skill, replacing negative behaviors with positive behaviors to bring about positive results or greater results. All right. Let's go to number 5, and that is recognize the halt symptoms. Some people may be familiar with the halt symptoms, some people may not. So today we're going to shed some light. This article is going to give us shed some light on the halt symptoms. HALT is an acronym for hungry, angry, lonely, and tired. All right. It is a helpful way to remember 4 common triggers of drug or alcohol cravings. If someone experiences a craving, they should check for these symptoms: hungry, angry, lonely, and tired. That's the HALT symptom. It's an acronym. Coping with addiction, HALT symptoms may reduce cravings. For an example, someone who feels a craving because they are hungry can eat a nutritious meal. Someone who feels a craving because they are lonely can seek support from loved ones, right? Understanding how HALT affects an individual's craving can also help with prevention. The person can avoid situations that bring about these triggers and potentially reduce their risk of relapse. Very good, very good. The HALT symptom, right? Hungry, angry, lonely, and tired. Don't forget that is an acronym that one can use to reflect upon and counter craving from alcohol or drugs. 6, manage triggers. I always like this one because it helps me out a great deal. Cravings is 1 or 2. I learned about urges, cravings, and triggers when I was in the therapeutic community. And once I began to hone in my senses of what that actually entails and how it relates to me and how it relates to me and my environment, I began to respond adequately. All right. So stress, hunger, anger, loneliness, and tiredness are not the only triggers of cravings to watch out for. The following are also common triggers for relapse after treatment: being around people, places, and paraphernalia. I'm used to the term people, places, and things, but this article make it specific. All right, the things to stay away from, and they say paraphernalia that remind the person of their addiction. All right, good stuff here. I'm telling you, this is It's up there with some of the great articles that we have shared on this MIT or any meetings that we have shared. This is one of the ones that's up there. Seeing the person's substance of choice. All right. Attending celebrations, major, such as holiday gatherings and birthdays. Preparing a plan of action ahead of time can help people manage these triggering situations. All right, plan of escape. Share the plan with a friend, family members, or partners for support and accountability. Navigating emotions aside from anger, this is good, may also trigger desire to use substances. Now, we talk about a lot of times we share information, we are reminded that there are underlying factors that need to be addressed as well for people who are in addiction and people who are just coming out of addiction treatment facility. All right. And one of them is emotions of anger. All right. Practicing mindfulness, journaling, or exercising are excellent coping mechanisms for managing these challenging feelings. All right. So find something. Always find something. I am a believer of us doing it what I believe, doing a inventory, self-inventory of myself, of my emotions, of my thought process, of how I respond. And I believe doing self-inventory is a great assessment tool because it helped me to evaluate because I'm always taught and I embrace it to keep the focus on myself. And so in that way I don't blame shift, place the blame on someone else. I take full responsibility for things that I say, things that I do. Right? Where we at? Number 7, do activities you enjoy. All right? Addiction hijacks the brain's reward center, releasing large amounts of a chemical called dopamine. Dopamine regulates the feelings of pleasure. As someone continues to abuse drugs or alcohol, the brain can become resistant to dopamine effects. People with substance use disorders may be more prone to boredom after treatment for this reason. Boredom can then trigger cravings, right? When this happens, people can turn to activities they enjoy instead of drugs, alcohol, and addictive behaviors. Healthy hobbies like gardening, right? Doing arts and crafts, cooking, baking, or woodworking are stimulating activities to consider, right? Do productive things that keep your mind off your addiction. Stay busy, right? Work on things, challenge yourself to improve yourself. Do not become stagnant in your growth and development process. Always find something that would challenge you to do better in life. I'm a true believer of that. I'm getting a little dry mouth, so I'm drinking some flavored water. Going for a walk or spending time with loved ones can also help curb boredom-related cravings. Right? Find someone that who are your strongest supporters. Find someone. Now, this is a MIT Men in Training, but it doesn't exclude women. So when we say men, we're also talking about women as well. All right? And so I had to put that out there because I don't want no one to feel that we are gender biased in no way, shape, or form. All right? It's for everyone. All right? So we want to be inclusive. We don't want to exclude anyone. Let's go on to number 8, that is. Exercise regularly and live an active lifestyle. See, I'm getting up in age, so I know that I need to be getting on somebody's bike, on somebody's treadmill. I need to get myself moving. You know, they say you can get old, but just don't get rusty. I'll tell you, that's another topic for another day. Number 8, exercise regularly and live an active lifestyle. Exercise is similar to addictive substances because it activates the brain's reward system. As such, regular cardiovascular exercise and resistance training can be useful for people in recovery. Dozens of studies have looked into the benefits of exercise for addiction recovery. Researchers have found that physical activity may ease withdrawal symptoms, reduce cravings, improve sleep, and boost self-esteem. Wow. I gotta get busy. Living an active lifestyle is also recommended for good health in general. It is recommended that Canadian adults get at least 150 minutes of moderate intensity exercise each week. All right, good to know. Children and youth should get at least 60 minutes of physical activity daily. All right, and so that's something that new information to learn. Don't stifle yourself from learning. Remember, challenge. We have to continue to learn to challenge ourselves. Today we're talking about what are the 15 coping skills for addiction. MIT stands for Men in Training Recovery Support Group. Number 9, we're going to keep a daily journal and gratitude list. Journaling is a type of mindfulness that encourages people to focus on the present moment. Research shows that daily journaling can help with stress, general well-being, managing negative emotions, and making plans. Expert recommend starting slow with journaling. All right, you have to be the most proficient journaling person there is. Just start somewhere. Begin with available tools such as a note-taking application or a simple pen and paper. Don't worry about spelling or proper grammar. Just focus on writing, all right? Focus on the writing perspective. People who struggle with coming up with something to write can try prompts, all right? That's a good technique. You can use prompt. Journal prompt offer a topic to write on and can provide more structure, all right? When I was in college, I took this class. It was dealing with arts and science or something like that. And the professor of the class, he would come out of nowhere and say, "Today we're doing an impromptu." And we'd be like, "What? Where did this come from?" And it challenged us to pick a word, a topic, a subject, and expound upon it for X amount of minutes. And the more you do it, the greater and better you get comfortable at it. So prompts are very good as well. There are addiction recovery journal prompts available to get started. Keeping a daily journal and gratitude list can be one of the most powerful coping skills for an addiction. Number 10, mindfulness and meditation. Mindfulness and meditation are relaxation techniques that can enable emotional regulation, stress reduction, and addiction recovery. Specifically, studies have shown these practices to be beneficial for relapse prevention. A review of 54 clinical trials investigated the effects of mindfulness-based interventions on people in recovery from addiction. The review found that mindfulness improved cravings, pain, quality of life, depression, and anxiety in people recovering from addiction. There are many types of mindfulness to try. Focused attention and open monitoring are approaches commonly used for people with addictions. These practices promote a non-judgmental and non-reactive awareness of one's surroundings, emotions, and thought. Mindfulness and meditation. All right. And so these are some healthy tools that you don't have to do all of them chronologically. You can pick and choose which one best work for you, or which one that you find comfortable with doing. But if you're watching this, find or choose which one that you would like to start on, and just you may not have time in a day to do let's say 3 to 4 of them, but maybe one, at least one or two of these per day can be beneficial, so that as you grow and grow, you begin to grab hold and grasp more of some of the tools, that coping skill tools that we're mentioning or speaking on today. So we just went over 10 of them. We're going to cover all 15 today. Number 11, keep busy. All right, get moving, keep busy, and distract yourself from cravings. All right, that's number 11. People with addictions spend countless hours per day obtaining, using, and overcoming the effects of substances. Getting sober may free up a ton of extra time. All right. You don't have to, when you're busy doing things and constructive and productive things, you don't have time to be trying to do other non-constructive things. All right. It says, staying busy is crucial during recovery. All right. Let me read that again. Staying busy is crucial during recovery. Finding new hobbies and activities to fill one's schedule will prevent boredom, which we already mentioned is a trigger for cravings and potential relapse. People can distract themselves with many of the activities we've mentioned, including journaling, exercise, and trying new hobbies. Learning new things, all right? And remember, I talked about challenging yourself, learning new things, all right? Such as an unfamiliar language or instrument can also benefit people in recovery, all right? And so I'm going to share a little what I do to challenge myself, which I've been doing for maybe going on 3 years. I've been focusing on financial literacy, all right? And this has really been challenging for me because it's like, it reminds me of when I first went into the therapeutic community or treatment program. The language of the program, the terminology, the lingo, the whole structure of the lifestyle was totally new, different from what I was accustomed to. And it's as if I had to rewire my brain to really understand or comprehend or to embrace what was being taught. So that's what I mean by challenging yourself with financial literacy and pushing me to another level. I'm challenging myself. I'm learning new things that I never thought I'd learn or never thought. I was always interested, intrigued by it, but I'm really like, the more, when I first started, the more I read, the more interested I became. And then it went from just not only from a theoretical perspective, now it's more of a practical application. All right, enough of that for me. I just feel that I want to share that. Number 12, let's talk about number 12. Implementing a healthy sleep routine. Implementing a healthy sleep routine. Drug and alcohol use disrupt someone's quality and quantity and quality of sleep. The more severe the addiction grows, the more intense the sleep disruption becomes. Sleeplessness is also a symptom of withdrawal. Wow, you know that. Yet, addiction relationship to sleep goes both ways. Getting poor sleep can hinder recovery from addiction. The brain consolidates new learning and memories while sleeping, both of which are required for someone to learn new habits after recovery. So, getting good rest and good sleep is very important. It's vital to people who are in recovery. Creating a healthy sleep routine is an excellent tool for recovery. All right, it's a great tool for in recovery. Older adults should get at least 7 to 8 hours of sleep per night. So, if you're able to, and if you're not working on something to improve yourself, I always advise you always work on yourself. But if you're not working on something that can have you up studying. So if you're not in school and you're not studying for an exam or doing final papers or things of that nature, not working 2 jobs, whatever, then yes, do as the article suggests if you're able to. But if you're not, but try to get as much rest as possible. So I am in total agreement with that because I'm someone who really enjoys a good night rest. Practicing self-care. All right, we're on number 13. Self-care has been a hot buzzword over the past few years. I like self-care, but it may not be what most people think. Self-care is not overindulging in luxury accessories or expensive skincare products. Instead, it is doing good things for one's mental wellness and physical health. I really like this article. Self-care is an essential tool for anyone recovering from addiction. It can help people cope with stress and negative feelings better, boost self-esteem, and improve emotional resilience. Some examples of healthy self-care habits include practicing good oral health, attending annual doctor's appointments, and caring for one's hygiene. Self-care also means reaching out to a mental health professional when needing support for psychological symptoms like anxiety and depression, right? Practicing self-care. Remember, we're talking about what are the 15 coping skills for addiction. Yes, this is our MIT Men in Training Recovery Support Group. As once again, if you find any of these coping skills out of the 15 that you would like to work on, I suggest you start working on them as soon as possible. All right, let's go to number 14 coping skill that we want to talk about today. Build a sober support network. Number 14, build a sober support network. Studies have shown that the presence of healthy social support after treatment for a substance use disorder can improve outcomes. One review found that social support can reduce substance use, promote treatment engagement, prevent cravings, and foster self-efficacy. Yeah. All right. Importantly, not all types of support are equal. Recovering addicts must surround themselves with people who support their abstinence goals and will hold them accountable should they relapse. Let me read that again. Importantly, Not all types of support are equal. Recovering addicts must surround themselves with people who support their abstinence goals and will hold them accountable should they relapse, right? Find yourself some good friends and family members who are rooting for your success, for your sobriety, and for a better, healthy you, all right? It's always good. You know, we're going to always have people who may have their self-doubt, but you have to prove them wrong. And they're always about proving them wrong with our words. Let our words match our actions. All right? And so let's work on getting ourselves back on the straight and narrow. Those who do not have access to a healthy support system at home can join a 12-step group. 12-step groups like Alcoholics and Narcotic Anonymous allow individuals in recovery to get advice and assistance from others who are on the same journey. All right? So support groups are very, very good. All right. Number 15, help others. All right. Somebody bless you, you be a blessing to someone else. All right. Helping others has long been a secret to better health and perhaps even a longer life. Acts of kindness are linked to chronic inflammation. All right. Which is a culprit in the world's top causes of death. Volunteering and doing charity work are great ways to take advantage of these benefits. Even being more helpful towards loved ones and family members can impact levels of inflammation. People in recovery from addiction can boost their self-esteem and resilience through good acts. One of the best ways to help others is to become a sponsor or even a counselor. See, you can achieve just about anything that you put your mind to. All right, helping other people with addiction start their journey to recovery. All right, and so this article here has been a jewel. All right, and it has been something that I really enjoyed sharing on today. Remember, every Thursday at 3 p.m., we will have some type of information coming to you. If it's not a holiday, but every day that we have a work day here at Capital Recovery Center, we would like to just bring you some genuine good information and let you know who or where we get this information from. It's not of our own. We find articles on the internet and we read them and we think they are very vital to people recovery, vital to people sobriety. And so we just enjoy sharing this information because in order for us to keep our sobriety, we must freely give it away. Until the next time, my name is Craig. Enjoy and remember, love on someone. And remember, if you're having difficulties, struggling with your recovery, always seek professional help. All right? Take care of yourself.